I'm afraid we don't have a lot of updates on big data. And so if you were in Helsinki last year, a lot of this is going to look familiar, and I can just sort of comment on whether we've made progress in any of these areas or not, and kind of what the scene looks like now. If you were in Helsinki last year, I subjected you to this joke, and I just figured I could do that again, virtually and internationally. So, what is big data? We got to start with defining it, and so of course, we look to the internet for that. And if you haven't seen this before, I find it to be kind of appropriate for how to define big data. So, what is it? Big data is like teenage sex. Everyone talks about it. Nobody really knows how to do it. Everyone thinks everyone else is doing it, and so everybody claims that they're doing it. Um, so, so my definition of big data, the sort of colloquial version of it is anything that will crash Excel, right? So something that's too big to even open in Excel is going to be big data. And so once we got into things like collecting data across entire genomes and then on hundreds, if not thousands, if not hundreds of thousands of individuals, that is data that you can no longer just play around with it and sort it in Excel. Um, the kind of work we do in my lab, we do a lot of whole genome, SNP arrays, and we do a lot of whole genome sequencing. Like my laboratory, we have our own node on the campus supercomputer. And basically that's where we have to handle all of our data because your local machines can't do it. And so the question was, what's going on with dogs in big data? And ironically, I don't actually have a lot of data in this talk. It's more talking about the data. And because that's incredibly dry, I also tried to put funny pictures of dogs in here that have absolutely nothing to do with what I'm talking about. Um, when we had the working group, and I was honored to get to run that last summer together with Jerry Bell, we we basically said, wow, there's a lot of big sort of issues and problems that exist, and we could have had multiple different subgroups on some of those specific issues. Some of the challenges for big data, and I'll get to those in a slide coming up shortly. Some of the solutions, and some of them are kind of Rube Goldberg solutions, so they're just sort of cobbled together. The first steps that have been taken to make some of that big data publicly available, and then what are some actionable ideas that might fall under the realm of IPFD. So first challenges, there's just physical, mechanical challenges when you have big data. So data storage. I've lost track of how many terabytes of data space I have to pay for every year just for my research lab. And then transferring that data between my lab and somebody else's lab, analyzing that data, it just takes a lot of space. So this is not something you can do on your workaday laptop. Um, how to get the big data into formats that are going to be usable and interesting and beneficial, not just to the researchers and the scientists, but also to readers and the public. So people who may not even have much of a statistical background or a genetics background, let alone how to deal with really giant data sets. How can kennel clubs be using this big data, and which data sets do which kennel clubs have access to, and whether or not they're willing to share those publicly. This picture cracked me up. I think this is supposed to be Gimli from Lord of the Rings. Um, so the other sort of big piece that comes with big data is, we can generate a lot of genomic data. I could do SNP arrays on hundreds of dogs, but it's only useful if that genetic data also comes with clinical data, or what we call phenotype. So not just like what color is the dog's coat, but also health status, age when things happened for that dog, accurate age when things happened for that dog, and so forth. And so these are pretty massive challenges. The other question is who's providing the phenotypes. One of the biggest things that I see come up all the time it's as simple as body condition score. I think the average member of the public, when asked to body condition score their pet, is probably not going to use the same scale as a veterinarian. And then which one can you trust more? And can you integrate those numbers together or not? That sort of thing. And then what about updating that phenotype data? This could be, the dog was completely healthy at 3 years of age, maybe when that genotype data was generated, but then 2 years later developed congestive heart failure from a glycogen storage disease. Well, the researchers, the people maintaining that database, would really benefit from knowing that. So how do we update all those phenotypes on all these dogs all the time? And then we have to think about some of our statistical models. And I'm going to try not to get into too many of the weeds here because I realize probably a lot of you are not interested in statistical genetic models. But there's variables that need to be included in these models that we call fixed effects or sometimes covariates. Um, for example, if one of the big data sets that we do have are radiographs, x-rays from hips, from a lot of dogs that have had their hips certified PenHip, OFA, and so forth. But what method you used to do that is different and can impact that data, and so needs to be included. Sometimes sex needs to be included, sometimes sterilization status, whether they were sterilized or not, and then what age were they sterilized at. All of that information needs to be built into these genetic models. Continuing with challenges, there's also lack of standardization. So diagnostic codes, pretty much most clinics are using electronic medical records now, but being able to share between clinics depends on if they're using the same systems or not. How are the dogs identified? And then formatting that data in a way that's shareable. Last June, I found out about the European Union GDPR. I had never heard of it before, but there's a lot of protection of the human associated data. So the identification of the people, where they live, and that sort of thing can make tracing these dogs and their information even more challenging. And then consent. What sort of consent form is filled out when a sample is obtained or when DNA is generated? And does consent for one thing then necessarily give permission to use that data for any other kind of research in the future? So these were all issues that came up, and I'm not suggesting that we have solid answers for any of them yet. And then last, just money. Big data can be quite expensive. Storing that big data can be expensive. Hiring somebody who knows how to analyze that data can be expensive. So some of the things that we said, that sort of came out during the conversation was that we shouldn't be reinventing the wheel. And everybody was a little bit jealous of the Netherlands, where every registered puppy gets genome-wide SNP data generated. So we were all kind of enthralled with that. And they've got a system where it's connected and combined with clinical data. So, and that's something I think if everybody, or if all the countries in the world who are involved today, if we could get that going, that would be amazing. Some of the things that we do have, such as OFA, of course, has breed health surveys. These are utilized by the different breed clubs. They exist as templates that can be customized. There's no charge for those, and pros and cons. I mean, they're great that they exist. They can be anonymized, and unfortunately, they're not updatable. So again, that phenotypes change over time as dogs age. So what to do next was not 100% clear. Lots of education is needed just across the board. I think we all know that. I think helping breeders and the public understand that genetic tests are not what we call unequivocal destiny, and also that, and I think Dr. Hughes said this yesterday, they're not necessarily telling you who you should and shouldn't breed. They're just helping you decide who to breed to, helping people understand that. And then how do we turn all this massive, massive data into facts that are actually usable and actionable for breeders? And I threw this in as an example, and I am not saying that this is true, so don't anybody quote me on this, but as an example, if we could say that an inbreeding coefficient that increased by 1% was going to translate into 8 less days of life for your dog, if we had something really concrete like that, that would really help turn this big data into something useful for people. A lot of people are getting heterozygosity measures now when they do some of these whole genome type tests like the Wisdom Panel and EMBARK and so forth, and just teaching them that this is only one piece of a really big puzzle that needs to come into play when those decisions are made. So one of the ideas that was thrown out was to start with a small sort of small pilot project with specific goals using big data. And we thought maybe start with a breed that's quite small in numbers, where the gene flow is maybe more global, just by necessity because there aren't that many of them. And then, of course, we ran into another problem right away, which is how to identify these dogs. You're probably aware that in species like cattle and horses, all of that sort of identification is more standardized. And is that even doable with dogs? Microchipping and whether microchip readers will work in other countries. I mean, there's just a long list of hurdles. One other really fantastic suggestion that came out, and I do hope that this can be utilized soon by somebody probably smarter than me, is using AI, so artificial intelligence and machine learning, to try and help glean some really useful outputs from free-form fields and other information that's put into big data sets such as VetCompass. Or I always think of, Mars with Banfield. That's a human-generated data set that, like ChatGPT would just be thrilled to get to read through. So what can we do to optimize using those data sets and turn them into things that can help make our dogs healthier? So our first actionable idea was to try to get a web page on IPFD that collects and then annotates scientific papers on specific topics, and then giving like a lay summary paragraph, which not all papers will have when they're published, so that it's completely understandable even for a high school educated dog breeder. So one example is that science does support that estimated breeding values can be useful as a breeding tool. And helping breeders understand how to use those. So estimated breeding values they're a wonderful tool. They're used quite a bit in production animals. I like to joke that, in dairy cattle, they can tell you exactly how much methane each cow farted every day. It's not actually true, but it's somewhere pretty close to that. They know they can take one bull and they know exactly how much milk each of his daughters has produced at every lactation, and they can calculate these statistical estimated breeding values. And having something like that would be very powerful for dogs. It's just that because of the way we produce dogs, getting data like that is challenging. I don't think any of us would want to see all dog production across the world turn out the way a lot of the dairy cattle and chicken and turkey and pig production is right now, at least in the United States. And so that may never be perfectly solvable. But the goal was what can we put up on IPFD that basically has scientific support and proof for whatever that subject might be that we can steer people to, instead of just having to say, well, just trust me because I know what I'm talking about. There's also genomic breeding values, and I don't really have time to go into all those. Takes time to assemble and money to assemble those. Certainly these are used a lot in production animal, swine and chickens and turkeys. But that's, of course, by each of these big companies that own, millions and millions of animals. So I don't think we're going to be there with dogs anytime soon. Another actionable idea we had was also hosted by IPFD was another web page, sort of like the existing genetic testing provider list, where there basically is just a database of the databases. So here's a database showing you where all the different stakeholders are and what they have access to. So for example, the Kennel Club in the UK has phenotype info on hips and elbows and eyes. What genetic tests, without it being a giant list, with genome-wide data. We threw out the idea of the Golden Retriever lifetime study, of course, because that's going to be a pretty big data set. Is there going to be geographic information attached to those? And then, what might be of interest to owners, breeders, and others. So for example, like right now, there's about 3,000, give take, canine whole genome sequences that are publicly available through various sequence read archives. And I've used those for some of the research in my lab. And, I don't have a lot of phenotypes for the dogs. I just know their breed and sometimes their sex, but I can use them as controls because I can just safely assume that none of them have this, whatever obscure disease. And so there's ways that I think we could put it out there, like this is what's available. Recognizing, of course, that there are data sets that are owned and are proprietary that might count as big, but probably aren't going to be publicly shareable, at least for the foreseeable future. So if you have updates on genetic, on any big data that is like publicly available related to dogs, you're supposed to email it to Ames, just like you already do when you send her updates for the genetic testing providers. Another idea was some sort of template consent form. And, one of the things we talked about was consent and how it really needs to be consent, not just for this one immediate thing that we're using this for, but maybe any of the things that could come up in the future and how that would look. We talked about setting up an estimated breeding value working group that was supposed to be a little bit like the brachycephalic working group that came out of this conference when it was in Windsor, with the idea of exploring how estimated breeding values are currently used in dogs, how they could be used more effectively, how to educate breeders on those, maybe by making a short video. And I have to give a shout out to Dr. Melissa Cox, because she's the one who has at least made some attempt to get this started. And I think all of us are going to hopefully get much more done between now and Italy.